Hi, everyone, and welcome to Rural Roots, A Road Less Traveled, a podcast by North Country Healthcare.
We're your hosts. I'm Gavin Cook.
And I'm Ren Anderson, and we're so glad you're here. Gavin, today we have Greg Cook here with us.
Yes, Greg is our president and CEO at Upper Connecticut Valley Hospital. Greg, thanks for joining us.
Great. Thank you for inviting me.
Absolutely. And, to kick things off right away, as we kind of spoiled at the end of our last episode, obviously I know a lot about you, but if you could just give a quick introduction and a little bit about yourself.
Sure. So I'm Greg Cook, President and CEO of Upper Connecticut Valley Hospital. I've been here for almost 2 years. Coming up in first week of November will be my 2-year anniversary. I live in Littleton, New Hampshire, and have for the last 23 years, raising our family in Littleton. And so I make the commute to Colebrook every day. I've had several commutes over my career. It's probably the easiest commute I have. I tell people my commute has zero traffic other than an occasional logging truck or tractor. So it's an easy commute. It's a great time. I do a lot of podcasts. I do a lot of meetings while I'm driving on just over the phone, hands-free, of course.
Of course.
But it's just an easy commute, and the communities that I drive through are all the communities that we serve. And then I've been in healthcare for 35 years. Started background in pharmacy when a local retail pharmacy that was owned by my neighbor, and spent a number of years working in pharmacy operations. Did a lot of work with healthcare consulting around the country. Landed in Littleton for several years, working in pharmacy and ancillary services. And then, as you'll hear, at some point during the call, I made my way back here to North Country Healthcare just about 2 years ago. So.
And you said you're coming up on your second anniversary as CEO. What has this chapter been like for you?
Yeah, it's hard to believe that it's already been almost 2 years.
Wow.
The time has really flown by. When I first stepped into the role, it felt a little bit like drinking from a fire hose. There was so much to learn about the organization, about the people, the services we provide, and the communities we serve. But as I've settled in now, I've gotten to know the incredible team here at UCVH, or at Upper Connecticut Valley Hospital, sorry. It quickly became clear just how special this place is. What made the transition even more meaningful is that it was also a return for me. I previously served as the North Country with the North Country Healthcare System as the system director of pharmacy back when NCH first formed. After being 4 years away from NCH, coming back to felt like coming home. I already knew the strength and potential of the system, and it's been inspiring to see how much progress has been made, and now to be part of leading that continued growth is really important. One thing that I witnessed day one and continue to witness every day here at Upper Connecticut Valley Hospital is the passion and dedication of our staff and providers. They care so deeply about the work they do, not just about healthcare, but about the taking care of their neighbors, their friends, their families. Upper Connecticut Valley Hospital is such an important part of this region. It is the most rural, furthest north hospital in the state of New Hampshire. And it's just an honor to be part of that mission to keep healthcare here in the most northern part of Coos County. But it's been truly a rewarding chapter in my career. And the support I've received from the team here at UCVH, Upper Connecticut Valley Hospital, as well as my colleagues across North Country Healthcare at Weeks Medical Center, Androscoggin Valley Hospital, and Home Health and Hospice, and of course the NCH team, North Country Healthcare team. It's meant a lot. It's certainly helped me grow as a leader. It's helped me transition to this role, and it reminds me every day of why we do this work.
Greg, I want to ask a question because you mentioned the word system. And I think it's really important that when we're talking to our listeners, we're telling them what that means and why there's strength in being in a system. Can you talk a little bit about what that means to you and your work at UCVH?
Sure. I think for me, system is about, creating the system was about creating stability in the North Country. I think trying to operate independent rural healthcare hospitals has become more and more challenging over the last decade or more. It just continues to get more and more challenging. So I think the benefit or the important part of becoming a system and growing as a system is we're growing our stability. We're maintaining our stability and our ability to keep care close to home, close to our communities where it needs to be. I often think of just what would ever happen if we didn't have healthcare in the rural part of New Hampshire, and for our communities, it's one of the lifelines. People, how do you live in an area? How do you work in an area? How do you drive tourism to an area if you don't have healthcare?
Yeah.
So I think being a system and being part of North Country Healthcare is so important because it just provides that stability. The other benefits of being a system is that we're able to work together, and instead of everybody doing something independently or individually, we have the power of a team. We have strength in numbers. And so we're able to look at how we do things and how can we do them the same? How can we give the patients of the North Country the same experience wherever they go in the North Country, whether they're here at Upper Connecticut Valley or they go down to Lancaster, to Weeks Medical Center, or over to Berlin to Androscoggin Valley Hospital. What is the experience they have, and how do we get so that same experience is felt everywhere they go?
Great. Thank you.
Yeah, and I think, we touched on the fact that you have such a diverse background in operations, finance, pharmacy, supply chain, and on the topic of the system, how do you think all of those departments across the system can continue success and moving towards that one team, one mission that we have had the past couple months, actually coming up on a year now with that too.
Yeah.
But how do you think that is going to look moving forward as well? Kind of the systemization of all departments.
Yeah, I mean, I think first of all, as far as my background goes, I have a career of just growing experience in operations, working in pharmacy, finance. I did some work with laboratory services and with ancillary services, including supply chain, and supply chain at one of the most critical times, which was right in the middle of the pandemic with COVID, and how do we get supplies and protective equipment and vaccines and medications and equipment that we need for when the pandemic hit, and we all had no idea what that was going to mean to any of us. I've been grateful for that career path, that broad career path that gave me a really holistic understanding of healthcare. It's helped me lead with empathy. It's helped me be able to ask informed questions by having that background. And now, the ability to take that operation experience and work with our departments across the hospital, those ancillary operational departments, and help them really be able to relate to the teams across the departments and help them see the bigger picture of the work that they do and how it's important, not only for their individual hospital, but for NCH as a whole, for our system, and then of course how important it is to our community and the patients we serve. Leadership is rooted in supporting teams to deliver excellent care, and that's really what my focus has always been in operations. I think the future of NCH, and we've been working on this for several years, and a lot of work, over the last couple of years, of really moving towards, systemness, where we look at, a service line, like pharmacy, like lab, like diagnostic imaging, and saying we do this at every affiliate. We need it at every affiliate, but how do we do it together? And instead of reinventing the wheel on things 3 times, we're reinventing the wheel once, and we're rolling it out as a team approach. So I think there's a lot of work that has been done. There's a lot of work left to be done, especially as we unify and we look to see how do we align our services across the system, bring out efficiencies that we're currently not tapping into, and again, lead to a more stable healthcare, and again, be here for our communities for years to come. So I think that's, I think that's really where it's headed in the next couple of years. And we need everybody involved. It can't be just directed from up above down. We need everybody involved. We need our subject matter experts, which is our staff that are on the front line, patient facing every day. We need them to be involved in this. We need to hear them. We need to learn their challenges. We need to hear, help them remove barriers as leaders. But it's going to take a whole team effort, and certainly those that are patient facing on the front lines are who we're going to need to really tap into, listen to, and work with to keep moving forward in systemness.
You said something that reminded me of the conversation, Gavin, that we had with Nicole, and she said one of the things that she loves most about North Country Healthcare is that it feels like everyone's a piece of the puzzle. And I think that our leadership does a really good job. You mentioned subject matter experts, but as a whole does a really good job of deferring to expertise and making sure that those people who are closest to the job are doing the job and are being asked, what do you need to do your job better? What do you need to better take care of the patients? What do you need us to do to support you? And I think you touched on that as you were talking. It's just lovely to juxtapose that with Nicole, who's working new to the organization, already seeing that and already seeing how that fits into North Country Healthcare. But what else? What do you think that rural healthcare leadership requires that people outside of the setting, maybe people outside of North Country Healthcare, maybe in our communities, maybe people in a different industry, what might they not fully understand that it takes to be a rural healthcare leader?
Yeah, well, I think rural healthcare leadership is really unique. One thing people outside of rural settings, I don't think really fully grasp, is just how deeply connected everything and everyone is. In rural communities, healthcare isn't just about services and systems, it's personal. You're not just caring for patients, you're caring for your neighbors, your families, your friends. That creates a real strong sense of responsibility, of commitment that's hard to describe unless you've lived it and you've worked it in rural healthcare. We know what rural healthcare is here in Coos County, in the most rural part of the state. But believe it or not, they consider Lebanon, which is where Dartmouth Hitchcock Medical Center resides, they consider that rural healthcare. And there's such a difference between what Dartmouth does and what we do in the North Country. So I think really the true rural healthcare that we have here in North Country Healthcare, that's really where it comes down to, that really closeness, that close-knit community that we're all part of. And, most of us either live in and work in our communities, or we live fairly close to the communities we work in. As a leader in rural healthcare, and any leader, department managers, up to executives, you have to be incredibly resourceful. We often have to, we hear this all the time, we have to do more with less. We have fewer specialists, we have tighter budgets, we have smaller teams, but the expectations and the needs are just as great. When you're in rural healthcare, you wear a lot of hats, and you have to be willing to roll up your sleeves, support your team wherever and whatever and whenever you can, whenever you're needed. It's also about building relationships, and not just within your organizations, but across the community. Trust is really important in rural healthcare. People need to know that you're invested, that you're listening, and that you're going to show up for them when it's time, when their time is needed. It's challenging, but it's also incredibly rewarding. The impact you can make in a rural setting is real, and it's immediate, and that's something that's really truly special about rural healthcare.
Yeah. Absolutely. And we're currently coming out of our community health needs assessment period, going into our community health implementation plan. And I know that during those community listening sessions, one of the most wonderful things was hearing community partners say, we want to help with that, or excuse me, we want to make sure that UCVH has these resources and know how to access them. So when you talk about, not being able to do it alone, and that really resonates with the both the impact we have on the community and the fact that to provide high quality healthcare, we need our community, and we need our community partners to keep supplying the resources they do. So thank you.
Yeah, I think, and I caught onto a word you used a few times in that last piece, which is unique. And to me, Upper Connecticut is unique for a few reasons. Obviously, it's our smallest of our affiliates, but it's also the most rural of our affiliates. So can you talk about how Upper Connecticut Valley has grown or evolved, even just in the short, almost 2 years you've been there?
Yeah. I think it's been exciting to see how UCVH has grown or changed in the past couple of years. One of the biggest areas of progress has been the strengthening of our team culture and collaboration, not just here at UCVH or at Upper Connecticut Valley Hospital, but across the entire North Country healthcare system. We've made a clear move toward aligning with our system partners. That's helped create a stronger, more unified approach to care. The idea of one team, one mission has really started to take hold. You can feel the difference in how teams communicate with each other, how they share resources, and they support each other across the NCH or across North Country healthcare organizations. That alignment, again, makes us all stronger, better equipped to serve our communities. We've also made strides in improving access to care, whether it's through expanding service lines, improving workflows, enhancing patient experience. One key development here at Upper Connecticut Valley Hospital has been our new partnership, and it's not necessarily new anymore, it's just over a year. Our new partnership with Hospital Medicine Solutions, we refer to them as HMS, who now manage our hospitalist program. Prior to that, we were partnered with Catholic Medical Center, but during their transition to HCA and to private, to be a new partner with HCA, they got out of the business of doing hospitalist medicine in remote locations. So we had to find a new partner, and Hospital Medicine Solutions has been a great partner. Their collaboration with our nursing team, with our emergency room providers, and with our rehab team, it's really been instrumental in helping us say yes to keeping patients here at Upper Connecticut Valley, keeping them within our system, within North Country healthcare system, when it's appropriate to do so, which means keeping them closer to home. Anytime we can keep a patient here at Upper Connecticut Valley, or at the very least within North Country healthcare system, it keeps not only the patient closer to home, but families closer to their loved one, because the hardship of having a loved one be an hour and a half, 2 hours, 3 hours away when they're sick, when they're not feeling well, is really felt on families. They're having to either not go and not be with their loved one, or they're having to take time off from work, incur hotel expenses and food expenses at restaurants while they're away. So anytime we can try to keep that care closer to home, that's really important. And that's one thing that we're really focusing on here at Upper Connecticut Valley Hospital with our partner, Hospital Medicine Solutions. On the operational side, we've made great progress, not only here at Upper Connecticut Valley Hospital, but across the system, in finding efficiencies, enhancing financial stability, and using data more effectively. As part of North Country Healthcare, we have a system goal where we are looking to identify $500,000 in system-wide savings, whether it's new added revenue, or finding ways to cut cost, or to do things that bring a value add back to the organization, whether that's through, whether or not that's improvements in how we work or just efficiencies, or it might be negotiating a contract from 3 different contracts with 3 different hospitals to one North Country Healthcare contract that now gives us, a better rate or a better pricing. So over the last year, our teams across the system, not only here at Upper Connecticut Valley Hospital, but throughout North Country Healthcare, have really been focusing on that. Our North Country Healthcare revenue cycle team has been also doing outstanding work behind the scenes, trying to make sure that we remain financially stable, and not just through this fiscal year, but for years to come. At the same time, we've got our IT teams and our clinical IT teams that are key partners for all of us in putting timely, accurate data into our hands as leaders to help with decision making, which is critical to driving smart, informed choices that we make. There's still a lot of work to do, of course, but I think we're headed in a really positive direction, and that's a credit to the dedication and to the heart of not only the Upper Connecticut Valley Hospital team, but across North Country Healthcare as well.
So considering all that, what do you really want your community, your staff, your peers to know about the direction that UCVH is headed in now?
Yeah, that's a great question. I think I want everyone, including our staff, our community, our peers, to know that Upper Connecticut Valley Hospital is moving forward. We're moving forward with a clear purpose and a strong sense of commitment. We're focused on continuing to explore and evolve the ways that make a difference for the people that we serve. That means looking for opportunities to expand access to care close to home, embracing innovation, embracing changes that bring more efficiency, and working together with our North Country Healthcare partners. Again, as the one team, one mission, to really overcome challenges and seize new opportunities for us. Here at not only Upper Connecticut Valley Hospital, but at North Country Healthcare, and I know you've talked with others in your other podcasts, our goal is to be a high reliability organization. And that not only meets the needs of today, but is prepared for the future, building on our strengths, supporting each amazing team that we have, and investing in technology and partnerships that enhance the care we provide. We're really dedicated to staying financially stable. That's one of my primary focuses, is to keep Upper Connecticut Valley financially stable and operationally strong, so that we can keep providing compassionate, patient-centered care here in Colebrook for years to come. And above all, I want everyone to know that Upper Connecticut Valley's heart is in this community. We're here to support our neighbors, our families, and each other. And that sense of connection that I talked earlier about to our communities, and the care that we provide to them, the goal is to continue to guide everything we do as we move ahead, focused on continuing care here in Colebrook.
That's great. And I think, leading into my next question, it's clear that the work inspires you and the community inspires you, since you've returned, but it's clear it's been that way longer than just since you returned to NCH and the North Country team. But can you just talk about anything that's surprised you in your return to North Country Healthcare?
I think what surprised me the most is, and in the best possible way, is just how resilient and adaptable our teams are. Healthcare is challenging, especially in the rural setting. And we all know that there's some really big challenges coming ahead in the next couple of years around changes in from the bill that was approved in July at the federal level. It's going to bring some changes to Medicaid. Um, those challenges are going to be upon us soon. Healthcare is challenging, especially in the rural healthcare setting. But the way that our people show up every day with their heart, with determination, and a real desire to make a difference, it's truly something special. It reminds me why I came back to NCH or to North Country Healthcare. It's why I'm proud to lead this team. The one thing that, that didn't surprise me but inspired me is, again, kind of on that same thing. It's returning to North Country Healthcare, is the unwavering commitment of all the people who work here, here at Upper Connecticut Valley Hospital in particular, but certainly across North Country Healthcare. I knew from my time previously with the system that we had dedicated teams, but coming back to the role that I'm in now, I've seen a dedication on an even deeper level, whether it's clinical staff, support services, and the administrative teams we have across the system. There's a shared sense of purpose that runs throughout Upper Connecticut Valley and all across the North Country healthcare system. So it wasn't really surprising. It was stuff I knew was there, but really, it's just amazing but that's really about North Country Healthcare. The people in North Country Healthcare are resilient. The people of the North Country are resilient. You think of the people that lived here for generations. If you don't know rural healthcare and you don't know rural healthcare in the North, the winters are long, the winters are gray. You have to be resilient. You have to be tough. And not only are our communities and our patients tough, but our people that work within Upper Connecticut Valley Hospital and all across North Country Healthcare, they are resilient. They are tough.
Well, Gavin always asks, what inspires you most? What keeps you going in this job? What a great answer do you have to be inspired by the people in the community and the resilience that you're seeing. I'm curious, as a leader, a healthcare leader, what do you do to stay grounded and take care of yourself and this hard work that you do every day, supporting your teams? How do you stay grounded in the work?
That's a really important question, and I think a lot of us sometimes forget about that. You forget about, you got to keep yourself grounded to be the best leader that you can be, or to be the best for your team. So I think what probably keeps me grounded is remembering why we do what we do. At the heart of it, it's about the people we serve, our patients, our staff, and the communities that we work and live in. In a rural setting like this, in Colebrook and Northern Coos, the impact of our work is personal. We're not just caring for strangers, which, we do at times. We have a lot of tourism that comes through. We do care for strangers. But again, I've said it a couple of times, we're caring about our neighbors. We're caring for our friends, for our own family members. That sense of connection, again, to the community, and a connection and responsibility of what we do in the community. That's what's incredibly grounding. I'm also grounded by the people I work with every day. Again, I've talked about it before, seeing the compassion, the resilience, the commitment of our team, especially through the challenges that we have faced in the past, that we face now, and that we will face in the future. It reminds me that I'm part of something much bigger than myself. It's humbling, it's motivating. It's what gets me out of bed every day. It's what gets me in the vehicle to drive an hour and 15 minutes north every day. And on a personal level, I try to stay connected to the day-to-day work. That's often hard because, as the president and CEO, my calendar is just full of meetings after meetings. Again, all important stuff, but trying to stay grounded and try to do what, rounding with the team. I definitely do not do it as often as I want to. I try to do it as often as I can, which some days and some weeks I don't leave my office because I'm in meeting after meeting. But it's trying to stay connected to that day-to-day work to listen more than I speak, and to keep learning every day about how to provide better healthcare, learning from my peers, learning from the staff, and learning from our patients. Um, this role comes with a lot of responsibility, but staying close to our mission, to our people, and to our purpose. It's really what keeps me centered and focused on doing what's right, for today and for the long term of healthcare in the North Country.
Well, and we're dragging you out of your office today, and tomorrow you're going to be joining me at the Moose Festival, which will already
And
have happened after this aired,
that's
but you
right.
can talk to the community there too.
Yes,
So excited to have
exciting.
you
The
there.
Moose Festival today. So this obviously is going to air after the Moose Festival's done.
Yeah.
But like Ren said, today and tomorrow we have a big festival here in the North Country, and so this afternoon we'll be out on Main Street. We have a tent that'll be set up we'll be doing blood pressures, and doing, I think they hopefully are trying to do some blood sugar levels, and then we'll be greeting and talking to our communities and learning, you know, hearing from them the stories of their time in their care that they receive here. We hear a tremendous amount of stories of how important, how critical it is to have Upper Connecticut Valley Hospital here in the community. But it's also an opportunity to hear from our patients of what can we do better, and how do we provide better care, and at the same time also hear and learn from what their challenges are. So excited for that. And then tomorrow, the Moose Festival moves to Canaan, Vermont, about 7 or 8 miles away across the river. So there'll be another tent set up tomorrow morning and into the early afternoon as the Moose Festival shifts over to a neighboring community. And we'll be there to do the same thing, take some blood pressures and glucose levels, and again, listen and talk with our community members about the good care we provide here at Upper Connecticut Valley Hospital, and across North Country Healthcare, and about how we can be better.
Yep, and
So,
we try to get to as many of those community events as possible. So always look for that bright green tent top.
there you go.
Well, that's great. And Greg, thanks again for joining as we wrap up here. I know we've covered a lot today. It's been wonderful. Is there anything else you would like to plug about Upper Connecticut Valley Hospital or NCH as a system?
No, I mean, the only thing again is just to repeat how, my number one mission is to keep healthcare here in the most northern part of Coos County. It may change. It has changed over the years. It's going to continue to change, but it's so critical that we maintain care here in the North Country. It's important to our communities. It's important to our businesses. It's important to our tourists that visit the area, to maintain care. So that is my number one goal every day. It's why we all do what we do here, and it's really my goal to keep that service here in the community for years to come.
Great answer. Well, thank you, Greg, and we're looking forward to seeing you out there.
All right. Thank you very much.
Thanks.
I really had a good time. Thank you.
You know, Gavin, I love talking to my dad. He's a veterinarian, and I love hearing his stories. And I'm curious, when you were growing up, were you hearing just hospital and pharmacy stories at dinner every time? Because I
I
heard some intense stories at the dinner table.
yeah. To be very honest, no. And I don't mean for that to sound rude or harsh, but I'm gonna get a little personal here, so bear with me. But he's a huge reason I came into healthcare and found that interest. And to be very honest, I had to pull that information out of him rather than him, come home from work and it's work all the time.
Yeah.
He is a great mentor, a great, leader, but for me, he's the, a great dad. He sets a great example of, coming home, leaving work at work. So I take things like that for myself more than anything from him. Obviously we talk shop, we talk work every now and then, and of course, my mom and brothers, they don't love it, or they don't get it, but it happens. But no, he's a huge reason why I'm in healthcare. He's set the bar very high for myself and my siblings in terms of work ethic. I certainly think, a lot of people tell me I'm a lot like him, and I think it's just that he set that tone at such a young age. And yeah, great great footsteps to follow for myself and my siblings. And I certainly would not be where I am, if it weren't for that mentorship and peace.
Well, gosh darn it, Gavin. I thought
Yeah,
I was
I
going to
know.
get through an episode without crying.
I just barely made
I'm
it
really
through.
not this much of a softie, but on this bad podcast, I am just a puddle. So, well, thanks for sharing some insight, that personal insight. I know you like to keep it pretty professionally wrapped, but I enjoy getting to know you through this podcast, and I'm sure our listeners do too.
Yeah, no,
And
one thing I've said, when I first started with North Country Healthcare over a year ago, it took probably 3 or 4 months. I had some people that were like, "Oh, Greg's your father?" And I was like, "Yeah, you can't tell the resemblance, the last name." But it's just funny. It gets me every now and then. There's some people that they're like, "I never knew." I'm like, "Huh, okay."
yeah. Well, great guest. He's, you can tell that he's so passionate about the community he's serving, and he cares. I've worked with him on a number of grants and community initiatives, and it always comes down to making sure the patients have what they need. And you can tell that the people he works with and the people he works for, as being the community and his patients, just inspire what he does every day. So
Absolutely.
wonderful, wonderful guest. And we have another wonderful guest coming up. Julie Bolton is going to join us. Julie is our system infection prevention registered nurse, and she also is an emergency room nurse. She works at Weeks Medical Center and Upper Connecticut Valley Hospital, as well as Androscoggin Valley Hospital, and we're very excited to have her. She has an interesting story. She didn't start in healthcare. She kind of took a winding loop to get there, and she's just so passionate about what she does. I sit with her on the High Reliability Organization Committee, and she also likes a good game. So excited to talk to Julie on our next podcast.
Absolutely. And I think you just said it, passion. Every time I talk with her, she has passion for what she does and this community. So right there with you, I'm very excited to have her on.
Good. Well, until then, I'm Ren.
And I'm Gavin, and this is Rural Roots, a road less traveled.